The CDC, Centers for Disease Control and Infection, released a report in 2016 on healthcare-acquired infections, HAI. The link is below. It indicated on any given day, 1 in 25 hospitals in the USA will have at least one healthcare-associated infection. Their report indicated there were an estimated 722,000 HAIs in US acute care hospitals. Additionally, about 75,000 patients with HAIs died during their hospitalizations. More than half of all HAIs occurred outside of the intensive care unit. The real concern here is that HAIs are often preventable, and by far the majority of these infections were spread by healthcare workers ignoring aseptic techniques. Of the annual 722,000 HAI infections, 157,500 were attributed to surgical site infections from any inpatient surgery, 123,100 attributed to gastrointestinal illness, with another 71,900 attributed to primary bloodstream infections. According to the US Department of Health and Human Services, the link is below, in an article updated in January 2019, healthcare-associated infections are among the most common complications of hospital care, leading to significant mortality and costing billions of dollars annually. Data indicates that nearly half of all HAIs are caused by indwelling devices, such as those associated with ventilators, pneumonia being the result, central lines and catheters associated with urinary tract infection. Clostridium difficile now accounts for around 12% of infections. C. difficile is a spore-forming bacterium and is spread by bacterial spores found within feces. Signs of infection by the bacteria range from mild diarrhea to severe and life-threatening inflammation of the colon. Methicillin-resistant Staphylococcus aureus, MRSA, is also a serious threat to many hospital patients. Around 94,000 people annually develop serious MRSA infections, of which 19,000 die from infection each year. It may seem paradoxical to many that a patient enters hospital to improve their health, but may be discharged with lingering infections they picked up during their stay, which prevent a return to health. Do some doctors ignore basic safety precautions? It would appear so, as evidence suggests that 3 basic precautions, hand hygiene, proper disinfection of equipment and the environment, and separating patients colonized with MRSA from the general population, and ensuring healthcare workers use gown and gloves approach when treating these patients, would dramatically reduce all types of healthcare-acquired infections. Please hit the subscribe button if you want to learn more about the myths and corruption surrounding medicine. It's the little image of a Neanderthal on the bottom right of your screen. Also, please indicate whether you like or dislike this video. Thank you.